So my health promotion topic is hypertension in incarcerated women. The problem was a random survey in California prison inmates found that women had a high incidence of hypertension. And some background about that information, what I've discovered is that there is a high incidence of hypertension in women. In fact, they found it to be 1.5 times higher in 2012 than in the rate of in 2004. And within these incarcerated women, there's also a higher incidence of hypertension than the general population. There's also a higher incidence of obesity or morbidly obese than their incarcerated male counterparts. And we know that obesity in combination with hypertension can contribute to cardiovascular disease. Incarcerated women also report having a higher incidence than their male counterparts for chronic health conditions in general, but the most frequently reported is hypertension. Let's see, and this also ties into Millennium Goals because we want to decrease poverty and improve women's healthcare and empowerment. And what we're seeing with these statistics is that hypertension is a chronic illness that plagues impoverished women, because usually the population in these jails are low income, or they have history of substance abuse, violence, things of that nature. Learning needs assessment. I would assess their readiness to participate in health behavior modification. Since they are incarcerated in jail for whatever reason, we have to assess whether the inmate is developmentally ready, their level of maturity, their affect, anything that would affect their attitude towards their health behaviors. We would also assess their ability to receive information, retain and understand health and education, anything related to communication, such as language barriers, cultural differences, education level, learning disabilities like dyslexia, even just like neurosensory disabilities. Do they need glasses? Do they need larger lettering? Do they need it? Are they hearing impaired? Do they need it in like simpler language? The community model that I chose is the proceed model in health promotion. I believe this model works well in the prison population because it's comprehensive and data-driven. The state and federal take surveys regularly, so they do have the resources and the time, because inmates do have a lengthy stay, so they can collect and interpret data collected from these surveys. I think this would work for this population because it's smaller than the general population, so the sample of chronic diseases is more concentrated in one area. So in order to use this community model, we would learn the perceptions needed or needs of quality of life of these inmates. Generally speaking, it probably wouldn't be a great quality of life, so we have to take in consideration their life experiences. Epidemiologic assessment, we would ID their health problems that they came in, and we would use state and national survey data to interpret this. Education and ecological assessment, we would identify their predisposing and reinforcing factors. These are their individual factors such as poverty, education level, history of violence, mental illness, substance abuse, and then their enabling factors, the communities that they were coming from, what services and programs or resources were available to them, their failure to meet their needs, or their inability to access these services. Administration policy assessment, these would be developing our interventions. We would strategize and plan on how to implement our interventions. So in the case of hypertension, we would screen them for high blood pressure. We would start developing diet modification, weight loss plan, look into their family history, see their comorbidities. I previously mentioned obesity, so they're probably going to have other comorbidities like diabetes and hyperlipidemia. And we would also implementation would start at the beginning. We would pre-screen inmates at intake, get an accurate health history as we can. There is a good possibility that they may be homeless, so an accurate health history is pretty much determined through a very thorough interview and thorough physical assessment. Outcome and evaluation and eventual modifications is we're basically looking to see if our care plan is working, and we would modify as needed. So our health promotion, health education plan, our overall patient goal was to control their BP and to reduce some of their cardiovascular disease risks. Generally speaking, with CVD, it's the result of uncontrolled hypertension and possibly also metabolic syndrome like obesity, hyperlipidemia, and insulin resistance. So behavior modification would target these behaviors that would contribute to these factors. So 3 behavioral outcomes that I chose would be smoking cessation, because nicotine increases vascular constriction and contributes to hypertension, weight reduction and maintain an ideal BMI, and to reduce dietary sodium to 2,300 milligrams per day to reduce the workload of the heart and retain less fluid. Research, other evidence. I looked at 3 articles. The most recent one is by the Bureau of Justice, or Department of Justice, Office of Justice Programs, and Bureau of Justice Statistics. So they have a branch dedicated just to surveying prisoners and jail inmates and playing with that data. So from this article, we came up with why this population, well, not why this population, but exactly who the population and their correlation with what illnesses that they have, and just how many are there and how are they coming into the jail system. For Binswanger, the chronic medical diseases among jail and prison inmates is from the Society of Correctional Physicians. So they also compare the chronic illnesses of the incarcerated to the general population, and this is how we know that it's a much graver situation, because there's just so much more of them in jail. Rethinking how to address growing female prison population. So this addresses the racial disparity in prison, the diversity in prisons, the health disparities in prisons, and all the underlying causes. This pretty much addresses how they got there, and the rate of which of this particular population is usually women of color and women of color, and the injustices with the justice system. So evaluation method. I would have them keep a BP log. I would have them monitor their blood pressure regularly, either weekly or monthly, depending on the severity, and I would track the trend. In this case, I would use intervention. For example, a patient will maintain BP within a specified range, such as not to exceed 130/80, or not to increase 10 points over their known BP for 1 month, and reevaluate in 1 month. I would also have them keep a food journal, measure their BMI, and track their weight loss while participating in an exercise program. the most simplest and easiest exercise program would be the 30 minutes walking for 5 days. I would also have them write down their feelings when participating in this program, because we know that wellness is not just physical, but it's also an emotional and psychological process. So an example would be a patient would lose 1 pound per week or 5 pounds in a month and reevaluate in a month, or the patient will maintain their BMI for their age and their height. So to discuss a way forward, I think a health promotion, in this case prevention, would also, because we have an opportunity to take advantage of the fact that they're in one place. We can use every time we interact with an inmate to teach and address the underlying causes that would contribute to them being there, which in the process we would also address their health issues. So we would address their underlying causes in the community to prevent the re-entry into the prison systems. In jails, there's a high turnover, so most likely women that are in jails might be re-incarcerated again if we don't address the problems that got them there in the first place. And then we would improve women's equality in healthcare. These women most likely will be discharged back to their neighborhoods or to whatever home from which they came. And they'll probably encounter the same cycle of violence, substance abuse, and little to no help in access to programs or rehabilitative services. So if they can't even get help for their day-to-day life, it's probably unlikely that they'll get help for their health conditions too. Correctional reform is probably the hardest one, because you're tackling the system. But we are seeing that there is a relationship between women of color and health disparities. There are racial disparities, such as black women being incarcerated 6 times the rate as white women, and women in general are being incarcerated at a pace that's like outpacing men being incarcerated. The data from the article I saw was that women in 2009 was 21.6%. The rate of incarceration, compared to men, which was 15.6%.